Welcome back to Great Day Houston. When I was in 3rd grade, I always got headaches because I was squinting at the chalkboard. Then we figured out I needed glasses. Problem is, that became a problem when I was playing sports. And even worse than that is the fact that it didn't stop the progression of bad eyesight. Joining us next is Dr. Julio Arroyo with Eye Health Consultants and Lily Rico. She received something called corneal molding, which is a great answer to either contacts you would have daily or having surgery.
That's correct. Hello, Deborah. It's great being here. Yeah, we have a very bright girl. She's Lily is 12 years old, and she wore glasses and contacts for quite a while.
Yeah, which is something that can help correct your eyesight to some degree, but what was it about it that you didn't like?
Well, since I'm an athlete, I dance and everything, and when I used to dance, like, the contact would fall out, and then I'd lose it, and then I wouldn't have time to find it, and it'd be a huge mess.
Yeah, and then I have other friends whose kids have allergies, and of course they're always rubbing their eyes and the contact would come out. What this is called is corneal molding, and the reason why you don't have to deal with it during the day is because you literally can go to sleep at night and wake up the next morning with perfect eyesight.
That is correct. So we like to say that you recharge the batteries of your eyes at night, so during the day you don't have to wear anything. So compare having to wear contacts all day long versus being able to see with your naked eyes without having to cut them off or do a laser or something like that. Yeah. So basically we are able to remodel, to reshape the corneal curvature onto the retina, so during the day you're seeing with your naked eyes perfect, like if you didn't have anything.
I gotta tell you, I did this, and it is amazing what it does. And it was almost like a magic trick. I woke up the next morning and went, yeah, you're nodding your head. So what was it like for you? So you put them in your eyes at night.
And then you take them out in the morning, and then after that, it's like the best thing ever, because then you don't have to worry about losing your contacts or your glasses falling off if you start running. And especially when because I'm in cross country, whenever I'd run and I got a dirt in my eye, oh my gosh, it was the worst thing ever. Yeah.
My glasses would just keep slipping down. I keep pushing my glasses up, and so I couldn't do any of that stuff. But it is almost like a magic trick. Okay, so people have asked me, okay, well, how long does it last?
Well, you know, initially it's supposed to last the whole day.
Right.
Obviously, if it doesn't last the whole day, did it last the whole day for you?
It lasted for. I would have to tell you, I would skip wearing it sometimes when I got so tired at night. I just didn't put them in, but I could still see days later. But the key is to keep wearing it, almost like if you had a retainer for your teeth, right? So you put it on your eye, it trains your eye to mold the way it needs to for perfect eyesight, and it's amazing.
Yeah, so it's supposed to last the whole day, and if it doesn't, we're not doing a good job. But a lot of folks just wear them a few times a week for maintenance. That's all it takes. How about you, Lily?
I wear them because sometimes I fall asleep really late, so I can skip a day. If I wear them one day, it lasts me like 2 days. Yeah,
and here's the great thing about it is that they're in while you're sleeping, so you're not having to deal with it. But probably more important is that for children in particular, they are not candidates for LASIK, right, for surgery.
Right.
And then, so what's great about this is that actually, by having that corneal molding, it stops the progression of bad eyesight.
That is correct. And you see, we are used to settle for, well, my kids are getting blinder, more myopic every year. Well, what am I going to do? Well, here's the new glasses. We're the stronger prescription. It doesn't have to be like that. We can now prevent that from getting worse. We're protecting this kid's future. You see, Lily's mom was also, by the way, here. She's a wonderful woman and wonderful human being. Anyway, she was very concerned about that. The prescriptions were getting worse every year, and nothing was being done. So now we're able to say we're stopping, we're slowing down very significantly the progression of myopia. So by the time they are 18, they don't have 5, 6, 7, 8 diopters. At the most, at the worst, they have a very low prescription. The point is that we are now protecting them for a lot of other conditions that happen when you're older: macular degeneration, retinal detachments, cataracts, glaucoma, etc., that happen as a result of a growing myopia.
Yeah. So this is great for kids, but it's also great for adults like me. What I was having a problem was seeing close up, and so you were able to correct that. You actually, and my eyesight for distance kind of was a softening as well, and you corrected both of those.
And you know, you weren't an easy one, other than the fact that you're very
There's
positive.
There's nothing easy about me.
But you know, exactly right. Many of the patients that come to us say, well, I saw great all my life, and now I can read up close. So one of these things, one of the things we're doing
happens to most of us with age is that we're going to have trouble seeing close up, right?
That is correct. So what we did with you is to modify it in a way that we balance both distance and near, so you can also as well read up close.
All right. So literally sleep at night, wake up, and see perfectly. And so your life is like much better now, not having to deal with all that.
By a lot, because since now I get to do all that, I don't have to worry about putting those contacts in the morning, and then if I lose my glasses and a bunch of other stuff.
Yeah.
So, yeah, it's
All
really,
right.
really helpful.
If you'd like to know more about corneal molding with eye health consultants, there's a free consultation and $300 off the evaluation. You can log on to sleepandsee.com, sleepandSee.com to see how corneal molding could work for you, or call this number for Dr. Arroyo's office, 281-419-3355, 281-419-3355.